Hello everyone, my name is Gail and today we're talking about a paper looking at behaviour changes in children on the autism spectrum after a febrile or fever medical event. So anecdotally, you may have heard that some people report that some children on the autism spectrum show a positive behavioural change after a fever or febrile medical event. And this has led to the hypothesis that potentially there may be some inflammatory related processes that might be different in children on the autism spectrum that may impact brain and behaviour. However, a lot of this evidence has really come from historical retrospective recall of what's happened in a child's life. So this study that we're talking about today is actually a prospective study, so looking and tracking individuals over time. And so what this research did is they looked at a sample of around 200 children, 140 of which were diagnosed on the autism spectrum, and tracked them over 3 months, looking at different types of medical events that might have happened, recording their temperature, and getting parents to record changes in their child's behaviour. So the main findings of this study were that there were similar rates of febrile or fever-related events and non-fever-related events in both children with or without a diagnosis of autism, and that regardless of diagnosis, children who had a fever-related event showed a worsening of their social, emotional, and behavioural symptoms in that week after experiencing a fever. And that was compared to when they entered the study and compared to non-fever related medical events. And there was a very small minority of children on the autism spectrum who did show a positive behavioural change after a fever. So what this research shows is that regardless of diagnosis, children actually tend to show worsening of their behaviour and social or emotional symptoms after a fever-related event, and there might only just be a small minority of individuals who do show a positive behavioural change. But really there needs to be a lot more research tracking individuals over a longer period of time to verify these findings.